Every morning, he followed the same routine. He woke up before sunrise, made himself a cup of coffee, read the morning headlines, kissed his wife goodbye, and headed off to work. To everyone around him, he looked perfectly healthy. He exercised a few times a week. He rarely got sick. He had no major health complaints. There was nothing to suggest that anything was wrong. But deep inside his body, something had already begun. A tiny group of abnormal cells, hidden within a small gland no larger than a walnut, had started multiplying. Quietly, slowly, without pain, without warning. Days became months. Months became years. And still, he felt completely normal. Until one ordinary morning changed everything. His doctor looked up from a folder of test results, paused for a moment, and quietly said the words no man ever wants to hear. "You have prostate cancer." In that instant, his world stopped. The plans he had made for retirement, the vacations he dreamed of taking, the moments he hoped to share with his grandchildren, suddenly felt uncertain. But perhaps the most frightening part wasn't the diagnosis itself. It was discovering that the disease had been growing silently for years, without a single symptom he recognized. Prostate cancer is one of the most common cancers affecting men around the world. Yet despite advances in medicine, thousands of men are still diagnosed after the disease has already spread beyond the prostate. Not because they ignored obvious warning signs, but because there often weren't any. That's why doctors frequently refer to it as a silent disease. It can grow quietly for years before making its presence known. And when symptoms finally appear, the cancer may already be much more difficult to treat. The mystery. So why is prostate cancer so difficult to detect? Why do some men live for decades without ever knowing they have it, while others develop an aggressive form that spreads with alarming speed? Why does one simple screening test have the potential to save lives, yet millions of men continue to avoid it? And perhaps the biggest question of all, could you have prostate cancer right now, without realizing it? Those questions have challenged scientists and doctors for decades. But today, we're going to uncover the answers. We'll explore how prostate cancer begins, the warning signs many men dismiss as just getting older, who is most at risk, and how early detection can make a life-changing difference. Because by the end of this video, you may never look at your health or your next medical checkup the same way again. And what you'll learn next may be the most important part of all, because prostate cancer doesn't start where most people think it does. To understand why prostate cancer is so dangerous, you first need to understand the organ where it begins. Hidden just below the bladder sits a small gland about the size of a walnut. It's called the prostate. Most men rarely think about it. In fact, many don't even know what it does until something goes wrong. Despite its small size, the prostate plays an important role in the male reproductive system. It produces a fluid that nourishes and protects sperm, helping it survive on its journey. For decades, this tiny gland can do its job without demanding any attention. But sometimes, something changes. A single prostate cell develops damage to its DNA. Instead of growing, repairing itself, and dying as it should, the damaged cell keeps dividing. One cell becomes two. Two become four. Four become thousands. Then millions. Over time, these abnormal cells form a tumor. And here's what makes prostate cancer especially deceptive. Unlike many other cancers, it often grows incredibly slowly. So slowly, in fact, that some men live their entire lives without ever knowing they had it. But not every prostate cancer behaves the same way. Some remain confined to the prostate for years. Others become aggressive, breaking through the walls of the gland and spreading to nearby tissues, lymph nodes, and eventually the bones. Once that happens, treatment becomes much more difficult. That's why timing matters. The earlier prostate cancer is found, the more treatment options are available, and the better the chances of living a long, healthy life. The warning signs. Most men ignore. The first warning sign is often so subtle that many men simply blame it on aging. You begin waking up more often at night to urinate. At first, it's once, then twice. Eventually, it becomes part of your routine. It doesn't seem serious, but sometimes it's your body's first attempt to tell you that something isn't right. Next, you notice that your urine stream isn't as strong as it used to be. It starts slowly. You strain to begin, or you feel as though your bladder never completely empties. Many men assume this is just a normal part of getting older. And while an enlarged prostate can certainly cause these symptoms, prostate cancer can produce similar changes. That's why they should never be ignored. Then comes a symptom that should always be taken seriously: blood in the urine, or blood in the semen. Even if it happens only once, even if there's no pain, it doesn't automatically mean cancer, but it does mean you should seek medical attention without delay. Some men also experience discomfort or burning during urination. Others notice changes in sexual function, including difficulty achieving or maintaining an erection. These symptoms can have many possible causes, but when they appear together or continue for weeks, they deserve a proper medical evaluation. And then there's the symptom doctors worry about the most: persistent pain in the hips, the lower back, or the pelvis. This isn't the ordinary soreness after a long day. It's deep, persistent, and sometimes worse at night. When prostate cancer spreads beyond the prostate, it commonly travels to the bones. For some men, bone pain is the first sign that the disease has already advanced. That's why recognizing these symptoms early can make all the difference. But here's the surprising part. Many men who develop prostate cancer experience none of these warning signs at all. So if symptoms aren't always present, how do doctors find the disease before it's too late? That's where screening and understanding who is most at risk becomes critically important. Who is most at risk? The truth about screening and treatment. Here's one of the biggest misconceptions about prostate cancer. Many people believe it only happens to very old men. The truth is far more complicated. While prostate cancer can occur earlier, the risk rises significantly after the age of 50. As men grow older, the chances of developing abnormal prostate cells increase, often without causing any noticeable symptoms. But age isn't the only factor. If your father, brother, or son has had prostate cancer, your own risk is higher. Genetics can play an important role, which is why knowing your family's medical history is so important. Research has also shown that men of African ancestry have a higher risk of developing prostate cancer and are more likely to experience aggressive forms of the disease. Although the exact reasons are still being studied, this makes awareness and timely screening especially important for those at increased risk. Lifestyle matters too. A diet high in processed meats and saturated fats, obesity, smoking, and a lack of regular physical activity have all been associated with poorer overall health and may contribute to a higher risk of developing or progressing prostate cancer. But here's the twist. Some men who exercise regularly maintain a healthy weight, and eat well still develop prostate cancer. Meanwhile, others with several risk factors never do. That's what makes this disease so unpredictable. It doesn't always follow the rules. The test that could save your life. So how do doctors detect a cancer that often causes no symptoms? The first tool is called the PSA blood test. PSA stands for prostate-specific antigen, a protein produced by the prostate. Elevated PSA levels can be caused by prostate cancer, but they can also rise because of non-cancerous conditions, such as an enlarged prostate or inflammation. That's why a high PSA result doesn't automatically mean cancer. Instead, it signals that more evaluation may be needed. Doctors may also perform a digital rectal examination, often called a DRE. Although many men feel anxious about this exam, it usually takes less than a minute and can help a doctor detect unusual changes in the prostate. If either test raises concern, additional imaging, such as an MRI or a prostate biopsy, may be recommended to determine whether cancer is present. Early detection can make a profound difference. When prostate cancer is found before it spreads, treatment is often highly effective, and many men go on to live long, active lives. From diagnosis to hope, hearing the words, "You have prostate cancer," can feel overwhelming. But a diagnosis is not the end of the story. Treatment depends on the type of cancer, how advanced it is, and the patient's overall health. For some men with very slow-growing cancer, doctors may recommend active surveillance, carefully monitoring the cancer instead of treating it immediately. Others may need surgery to remove the prostate. Some benefit from radiation therapy, which targets cancer cells while preserving as much healthy tissue as possible. More advanced cases may require hormone therapy, chemotherapy, or newer targeted treatments that continue to improve every year. Thanks to decades of medical research, survival rates for prostate cancer diagnosed at an early stage are very high. In many cases, the difference between a frightening diagnosis and a hopeful future comes down to one thing: finding it before it has the chance to spread. But even after successful treatment, many survivors say the experience changed the way they see life forever. And one man's story shows exactly why early action can mean everything. Let's go back to the man we met at the beginning of this story. When his doctor first told him he had prostate cancer, fear took over. Questions raced through his mind. Will I survive? Will I see my grandchildren grow up? Why didn't I notice something sooner? Like so many men, he had assumed that feeling healthy meant he was healthy. He had ignored the occasional late-night trip to the bathroom. He dismissed the weaker urine stream as simply getting older. After all, many of his friends complained about the same thing. But this time, those small changes were signs of something much more serious. Fortunately, his cancer was discovered before it had spread to other parts of his body. His doctors acted quickly. After discussing his options, he began treatment. It wasn't easy. There were days filled with uncertainty. There were moments of fear. There were nights when sleep refused to come. But there was also hope. Months later, his follow-up tests brought the news he had been praying for. The treatment had worked. Today, he spends his mornings differently, not because cancer changed who he is, but because it changed how he values every single day. He walks with his wife. He laughs with his grandchildren. He keeps every follow-up appointment. And he encourages every man he knows to get screened when it's appropriate for them. Because he understands something many people don't. Prostate cancer isn't always loud. Sometimes Its greatest weapon is silence. The bigger picture. Every year, countless families are affected by prostate cancer. Some stories end in heartbreak. Others become stories of survival. Often, the difference is awareness, knowing your risk, recognizing changes in your body, and talking openly with your healthcare provider about whether screening is right for you. No video, article, or social media post can diagnose prostate cancer. But learning the facts can help you make informed decisions about your health. If you're over 50 or younger with a strong family history or other risk factors, consider having a conversation with your doctor about prostate health and screening. That one conversation could make all the difference. Cancer doesn't always announce itself. It doesn't always cause pain. It doesn't always give you a warning. Sometimes it waits, quietly, patiently, until it's almost too late. But knowledge changes everything. The more we understand, the more prepared we become. And the sooner we act, the greater our chances of protecting the moments that matter most. Because in the end, the goal isn't simply to live longer. It's to live well with the people you love. If you found this documentary helpful, share it with the men in your life, your father, your brother, your husband, your son, or your closest friend. One conversation sparked by this video could encourage someone to seek medical advice at the right time. Now we'd like to hear from you. Have you or someone you know been affected by prostate cancer? What advice would you give to other men about protecting their health? Leave your thoughts in the comments below. Your experience could inspire someone else to take action. If you enjoy evidence-based health documentaries that uncover the warning signs of serious diseases before it's too late, subscribe to the Health Files and turn on notifications so you never miss an episode, because the next video might just save another life. Coming next, the silent signs of colon cancer. Most people ignore until it's too late.